welcome back to the morning show here on Arise News. Everybody wants a great smile, but a lot of us need help getting there. Joining us this morning to answer all our dental health questions, from oral health to choosing the perfect treatment for crooked teeth, is Dr. Amy Shumbusho, Clinical Director at Smile 360 Dental Specialist. Good morning and welcome to the show.
Good morning.
Good morning, Dr. Amy.
Good morning. Thanks for having me.
Thank you for joining us.
Yes, yes.
So let's start off with the importance of oral dental health. Many of us see going to the dentist as optional. So can you tell us exactly why it's a necessity?
Going to the dentist is something that should be part of our normal plans, because I always like to say that there is no healthy body without a healthy mouth. So everything starts from the mouth. And for a long time, people have thought that going to the dentist was just to go clean my teeth or really go when I have a terrible toothache. But we now know that we can keep our teeth till the end of our lives. So if we take care of them, we don't need to lose our teeth, we don't need to have dentures, we could just have a much healthier, life. Now, again, I like to talk from the cosmetic side, in fact, of what we see, because I have two people who are great ambassadors of smiles here today. And you could see that you would not be able to be on this show, directing this show, if for some reason, you don't have a pearly white teeth, an appealing smile, etc. Okay? Now, of course, there's the health aspect, whereby if you can chew, you're going to have other problems in your body because, hey, you'll be swallowing chunks of meat or things that you have not chewed, and you'll start having stomach problems, okay? So that is something that people have to know, that if you don't process things well in the mouth, then the other part of the body will suffer. So it's very important that we take care of our teeth. Now, there is the part that has to do with fresh breath, okay? And we know that we live in a community where you're coming close to people, and if you're not comfortable with your breath, it could be a problem in the office. It could be a problem in your family, in your marriage, etc. And it's even the fact that you actually don't perceive it. I know there's been something that happened about the housemate in Big Brother that has to do with body odor, mouth odor. Anyway, it's just to say that a lot of times it could hold you back, and you wouldn't even know that is happening. So it's an antisocial problem, and all that happens in the mouth. So going to the dentist twice a year, every 6 months, the dentist will be able to tell you, hey, there's something going on here. Let's clean, let's fix those cavities, let's make sure that you preserve your teeth so you can keep them, for the rest of your life, chew, function, and have a pleasing smile, okay?
So I want to ask you a couple of things. So the idea of keeping your teeth till the end of life is I think that's always a good way of positioning this. And I think as you get older, it becomes more important. I wanted to ask you, what role does genetics play in sort of tooth loss? Because a lot of times people say genetics, but maybe it's because of poor health dental care is why it has become a genetic. I just want to get your sense on how much of it is genetic and how much of it is just regular care.
Yes, that's right. I get patients telling me, hey, I've never been to the dentist. I don't have a cavity. I, don't necessarily follow all the guidelines, and some people are like, I always brush every day, I do fluoride, and yet I still have cavity. What's going on? So yes, there's a part that has to do with your enamel, and the way it's built. Some people have weak enamel and will be more prone to cavities and all that, and while others, will just be more healthy. But if you have the right oral health, brushings, and you follow all the instructions, good genetics, bad genetics, you'll be able to handle that. But going to the dentist will be telling you if you're on the right track or if there's something that, we can help you with. So again, a visit to the dentist every 6 months will help to guide you, if you're doing well or not.
So regarding what you said earlier about body odor, that is so much easier because we all know it's all been drilled into everybody, deodorant. With regards to halitosis, people think it's to do with what you've eaten, but it's really not. A lot of people don't understand that cavities contribute or a factor causing bad breath, and they don't, you can't, like you said, you can't diagnose a cavity on your own. People that do have cavities might even notice and think, oh, this hurts, I need a filling. They don't understand the fact that it causes bad breath. I'd like you to really underline that, because a lot of people don't know.
About bad breath, there is what we call extrinsic factors. There are some factors that, it could be that you have gastric reflux, you're brushing your teeth, you're doing everything right, and you still have bad breath, okay? But a lot of time it has to do with the mouth. It has to do with cavities. Sometimes it has to do with the way you brush, okay? When you eat, food goes around the teeth and goes into the gums. So now we're talking more about the gums, okay? Has it happened that when you brush, you see blood on your toothbrush? Yes. And that's due to the gum inflammation, gingivitis. So when you have that gum inflammation, you might be sleeping, and then the gum start bleeding. And that blood is what deteriorates and gives you that bad breath. You also have food particles stuck between your teeth, and that's what we talk about, not just brushing, but flossing to dislodge those particles that are stuck between the teeth, because they will stay there, get petrified, and then give you that foul odor, okay? So people have to know that it's not just about cavity. You could, use your brushing. You have to brush, floss, and make sure that you eat the the right food as well, okay? Because there are foods like onions, garlic. They're good. They're good. They're good for the.
They're good for the body.
For the body, but you have to do, take some extra care, there, okay?
So is there something that we can do especially with children, so that you start early? How do you start healthcare, especially for babies too? Like, what is the right protocol for babies? So that, because if you want to really get people into oral care, you have to start early.
Yes. I often ask, what's the right age to come to the dentist? I will say from the time you have the first tooth.
Okay.
Yes,
okay,
and as long as you have teeth, you will need a dentist.
Okay.
So you could see that it's really for the rest of your life. 1 year, once your child is 1, he can already start doing his first dental check, okay? And of course, most of the time, we take them on the chair, make them comfortable with the setting so that, we win them over, because sometimes we've lost the parents that come with their horror stories about going to the dentist. But, coming at 1, we, take you on the chair, check your teeth, and then give instructions about how to brush. When you're a little bit older, about 6, some of the permanent teeth start growing into your mouth and will now need more special care. We do fluoride treatment, we do sealants to protect those teeth, because we know at that age you still don't have the right instructions and about brushing. So we need to guide you, as those permanent teeth come into your mouth, because they are the ones that you'll keep for the rest of your life. Okay, so cleaning, scaling, and polishing every 6 months, that's something that we recommend. And the dentist will guide you according to your situation, what you need to do at every single point of your life, yeah?
So that leads me to the next question. Usually it's, not children, but teenagers, sort of, that area that starts to wear braces. But there's now been a new trend, almost, of adults wearing braces. It's never too late to correct your teeth, because
100%.
the braces that we're used to in Nigeria, a lot has happened recently, right? Can you tell us more about that?
Yes, that's my field.
Okay.
I'm specialized in orthodontics and dentofacial orthopedics, and I'm really passionate about invisible braces, okay? Because now we know that some adults who never had the opportunity, of their parents, getting their teeth straightened, and now they're holding, important positions, and they're like, I can't go around with my teeth looking this way. So with the era of invisible braces that are small, smaller, more comfortable, sometimes wireless, you can go on wearing braces and no one will tell. There's some people right now in government that are wearing braces. They are delivering their speeches. Yes, and no one knows they're wearing braces. So it's, yes, for the teenagers is a bit of a fashion, because they come saying, I want braces. I'm like, but you don't need braces. Of course, the parents are happy I could save a bit of that money, and so you need to guide them. But of course, there is a fact that as we are evolving, our jaws are getting smaller, okay? And the teeth are coming at the right, that ideal size. So the teeth are struggling with space. So a lot of people come with teeth overlapping, you know, and
I was actually going to ask you that,
yes,
so I'm glad you're going into that.
So that's why you see a lot of crowding and a lot of orthodontic conditions that we need to take care of more and more, or sometimes it's the other way around. Okay, you have jaws that are quite of a big size and then teeth that are smaller, so you need to create, you know, to balance that up. When you have a lot of spaces between your teeth, that can be a problem, okay? So you could see that it's not just about the health, the position of the teeth, the way you bite, the way the teeth come together, could also, you know, prompt you to, you know, seek for help from an orthodontist. So ortho means straight, and dentist in Latin means tooth. So an orthodontist is a dental specialist that straightens teeth, that takes care of your bite for the health of your teeth. Now, of course, for the beauty of your smile.
I mean, one of the things is that I found lately is so many people going in for extractions. And I think a lot of it is because either people wait till the last minute or till there's no sort of the point of return. And so it's people are, I mean, tell us like sort of, how do you avoid these type of, how do you avoid getting to this place where you have to get an extraction, or is it some extractions necessary?
Okay, some extractions are necessary, and there might be situations that you didn't even know, like wisdom teeth now. Yeah. In line with what I just said, our jaws are getting smaller because we eat food that are more refined. We don't chew as much, so our jaws don't work like before, so they get smaller, and there's some teeth, the wisdom teeth, that are now struggling with space. They actually can show up in the mouth. So some people need, you know, to have those wisdom teeth extracted. Now, for the other teeth, if we need to extract them, it will be really the ultimate solution. We do everything to ensure that you do not need to extract those teeth, from, you know, taking care of those cavities early. If you come for your regular check, doing what we call root canals and putting crowns over those root canals, just to make sure that we preserve.
What is a root canal, actually?
Okay, so a root canal is when the decay has gone beyond, you know, the crown of the tooth and it's gone into the nerve. Okay, so I know that sounds already painful, yes. And talking about why is it that we have to extract, most of the time is because
I want us to come back and talk about root canals, because I hear that all the time, and I never know what that means. So I think that's a good thing, though. We'll be right back after this break to talk more with our clinical director from Smile 360. Welcome back to the morning show. We're still in studio with Dr. Amy Shumbusho, clinical director at Smile 360. Before we went on break, you were telling us about root canals, which I think everyone cringed when you said when you said nerve. Can you just wrap up and tell us about root canals and sort of, are there any breakthrough treatments around root canal? Is it still as painful as some people cringing right now remember?
Well, what I'll have to say is that root canals are necessary to be able to, how do I say, keep your tooth in your mouth, okay? Now, it's just another procedure, okay? I know there's been a lot of horror stories that have been built up around, you know, the world root canal, even up to, you know, some of the comics and all that. But it's just another dental procedure. It's like we do a filling, it's just that now we have to go a little deeper, because the infection, which is the tooth decay, it's an infection, it's good for us to know, has gone beyond and it's gone into the nerve of the tooth. And when we talk about nerve, everybody, you know, freezes, and we talk about pain. But the good thing is there's been a lot of advancement in dentistry and in the health sector, whereby you have, you know, anesthetics, whereby you can have a root canal, not feeling anything, and you're living with your tie in place, your lipstick in place, and then you've just had a root canal, just like any other procedure. So it's important that we take away that infection, how far it's gone, okay, to ensure that it doesn't go beyond the tooth, all right? And that's the importance of root canal and the benefit of root canal, because you should know that the tooth is connected to the rest of your body. If we allow the infection to go beyond the tooth, that bacteria will circulate in your overall body, could go and get fixed into the heart, and you could have other problems, you know, hypertension, heart problem, diabetes, etc., just because you have not taken care of that cavity.
I read that. Alzheimer's, all kinds of things.
Yes.
Yeah.
Wow.
It is so important that people know, and that's really where my mission is to be able to get people to know how important their oral health is to their overall body. You cannot have a healthy body if you do not have a healthy mouth, okay?
But you just mentioned the fact that you can do this root canal and put your lipstick on and nobody needs to know what happened. It's not like this massive undertaking like it used to be. Let's talk about the advancements that have been made in dentistry in Nigeria and the sort of impression or perception a lot of people have that in order to carry out a procedure like a root canal, in order to get braces, invisible braces, you still need to go abroad.
Yes, that's another campaign we're running that's called Smiles Made in Nigeria.
Oh, that's lovely.
Yes, to be able to tell Nigerians that they do not have to take their passport or apply for a visa when it comes to their dental care. Everything they could possibly need, it's obtainable in Nigeria. There are various dental centers that are up to standard in terms of the skills of the dentist, in terms of equipment, in terms of the service delivery, in terms of even the customer care. Will treat you like kings, So there are various centers in Nigeria where you know that in terms of your dental care, you can be, assured that you get what is up to standard, okay? Now, traveling even abroad sometimes could be dangerous because you go there for one procedure, and then what happens next? What happens to the follow-up treatment, okay? So we want Nigerians to be able to reassure them that they could have their treatment done in Nigeria, and we'll be able to give them the best just because technology has evolved. Skills, we're having, several trainings, and that's part of my mission also to train even more doctors to deliver for everybody to up their game, okay? So, yes, Nigerians should not travel up, but I'm here to also speak to my other colleague dentists that we all have to up our game to be able to deliver the best if we want Nigerians to, to come to us, okay? It's very important that everybody has to play his role. The government is doing its part. I'm here speaking more about the private sector, speaking to my colleagues, speaking to Nigerians to say that, look, everything that you could possibly want to take your oral health, your cosmetic, your smile to the next level is available here, okay? We also even manufacture Invisalign now here in Nigeria.
Oh,
yes.
Oh,
if
wow.
we have to grow the country, it has to start with everybody in his field being able to develop, produce and create some appliances that you don't have to depend on the outside world.
Invisalign is the invisible braces.
It's the invisible braces. So
And
we have our own
it's
aligner.
produced here.
It's produced here using 3D
Impressive.
technology. You have, 3D printer, CAD/CAM technology. Your crowns.
Yes.
If you ever had a crown, you know how you used to wait for about 4 weeks. Now you could have a crown in a day.
Wow.
We start, you go have your coffee, you come back, your crown is in.
Oh, wow.
Better, faster, and more competitive dentistry. This is what has come to Nigeria, and it's important that Nigerians know about that.
Fantastic, fantastic. One of the things that we also have to be aware of is that there are quite a lot of people that don't have access to dental care. What can those people do to sort of at least maintain a healthy smile? And then what do you think the government needs to do to sort of, our social services need to do to make sure that because it's such, the way you're talking about dental care, it really becomes part of an overall healthcare regime that it's so important as an important part. How do we talk to people that don't have access?
Okay, so I know for sure that the health insurances have done quite a great work, yes, honestly, because there are more people who are getting into, health insurance. And then health insurances have now accommodated some, not all, but some dental services. So a lot of people, will come for a dental check and then we discover things that they need to do. So I believe that the government is doing its part, that, government centers there. The health insurances are doing their own part. We, as dental practitioners, have to do our own part. Me being here, thank you for having me again. We need to create awareness. I think the biggest barrier is really non-information, no education, no awareness about how important it is to us. What are the consequences of not doing anything, okay? What are the benefits? What are the benefits, And people knowing that those are the services that are available here in Nigeria. So it's all about communication, communication, and communication.
Is that where your project Smile, everybody deserves to smile, your CSR, is that where that comes in?
Yes. We're rounding up on Tuesday. We're having the screening. We have over 150 people that entered the competition. We'll call it the Worst Smile competition, where we offer young adults the opportunity to transform their lives. And really, when I say transform their lives by changing their smile, we've had so many good stories. But of course, you start with the sad stories, whereby they are not able to have a job. They're not able to socialize. They're not able to get married. They can't attend an interview because of the flaws of their dentition. Okay, so we offer, those lucky individuals the opportunity to really change their smile. And we've seen how it changed them from within and how it opened the world opportunities to them. So we know that a smile can hold you back. And we want people who actually can afford it to also know that something can be done about it. Okay? So beyond Project Smile, that is really dear to my heart, I know there's some people out there that will tell you, the patient said, you know what, I lost this tooth in front, but I'm fine with it. Sometimes it's not just about you, because you are a CEO of a company, I told him. You'll be going to board meetings, and you're having some international partners coming to you. And in that other part of the world, when you miss a tooth, it's really because you cannot afford. So you really, it's more like a neglect, So I said, you have to do it because of your position. And even if you are a minister or you're occupying a particular post, you know that you're doing certain things because of the office that, you're actually representing, not just this is how I feel and this is how I want. So it's important that you know that a beautiful smile and aligned teeth, a healthy teeth, can actually make you look more successful, make you look more competent, more confident. And people will love to listen to you, will love to, to give you that authority just because of your smile. It's the first thing that we see.
It's amazing how powerful a beautiful smile is. All right, so basic healthcare. So what should people do? How many times a day should you floss? How many times a day should you brush? Like, what do we do every day?
It's something that we have to keep reminding people. You have to brush at least twice a day for three minutes, okay? So morning, if you're having breakfast, brush after that breakfast, not before. So when you leave out, to meet the world, you're living with a fresh breath, nice, clean teeth. And then during the day, we know how hard it is. You go on with your regular day routine. And in the evening, it's important that you brush before going to bed. The last thing you do. So when you go to bed, your mouth is clean. And when you wake up, of course, it's clean. Have your breakfast and then brush after. So twice a day, brush, use your floss, and then of course, I always like to insist, visit your dentist every 6 months.
So you floss before you brush, or you brush before you floss?
You brush and then floss.
Ooh.
Oh, yes. Brush, and then floss to take away those little particles. Mouthwash, if you have mouthwash, use it, but don't abuse it. Okay? Once in a while, using the mouthwash, yes.
Oh, thank you so
Dr.
much for an
Amy.
amazing session. Thank you so much.
Pleasure.
And hopefully we'll all keep smiling and have a wonderful day.
Thank you.